Have you tried the little blue pill and found it's just not giving you the results you expected? I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to walk you through the main reasons your medication might not be helping you achieve the erections you should be having. If you're new here, I create urologic content every week covering sexual health, bladder health, and much more. If you find this helpful, be sure to subscribe and share this channel with your friends. So first, let's talk about timing. One common misunderstanding is that once you take the pill, you're instantly ready. But that's not how it works. You should take it about 30 to 60 minutes before sexual activity, and it still requires some level of stimulation to be effective. Some people even avoid taking it before dinner because they're concerned they might get an erection unexpectedly. But it doesn't work that way. It's not designed to cause an erection on its own. It helps support and maintain one when there's proper stimulation. For example, if you're aroused by touch or something you see, then yes, an erection can happen. But that's exactly how it's supposed to work. You need stimulation for the medication to do its job. Also, the way you take it can vary depending on the specific medication. Some, especially sildenafil, avanafil, and vardenafil, should be taken on an empty stomach. If you have food in your stomach, it can slow down or even block how well the medication is absorbed. In that situation, even if you take it, it may not work properly because less of it gets into your system, though you could still experience side effects. Many people make this mistake and then assume the medication doesn't work at all. And if you're using a low daily dose of tadalafil to help with erectile dysfunction, when you first begin taking it, it won't work immediately. It usually takes about a month for the medication to build up in your system before you start noticing consistent erections again. So give it at least a full month before deciding it isn't working. And finally, this medication can't fix everything else that may be affecting you. If there are challenges in your relationship that are making intimacy more difficult, those issues can still interfere with your ability to get an erection. Also, if you're drinking a lot of alcohol, whiskey dick is a real thing. Alcohol acts as a depressant on the central nervous system, which means it can make it much harder to achieve an erection. That's because the signals between your brain and body, which all need to work together, become slower and less effective. Some of you may have heard about lozenges or fast-dissolving tablets that you can take instead of standard pills. So, is there a difference? Studies on these rapidly dissolving forms have shown that they may work a bit faster. Sometimes within 15 to 30 minutes, people begin to notice results. Another advantage is convenience. You can take them discreetly without needing water, since they dissolve right in your mouth, making them easier to use. However, when it comes to overall effectiveness, there hasn't been a significant difference found between lozenges and regular tablets. One thing to keep in mind is that lozenges are often more expensive because they're made by compounding pharmacies. On the other hand, tablets are more likely to be covered by insurance if you have it, and you can also find coupons or online pharmacies that may help lower the cost quite a bit. Let's now go over the specific medications. Sildenafil is the oldest option and the most well-studied. You should take it about 1 to 2 hours before sexual activity, and its effects typically last around 4 to 6 hours. Tadalafil, also known as Cialis, came next. This medication can last much longer, up to 36 hours, so if you take it, you may still notice its benefits even a couple of days later. That's why some people prefer taking it on a Friday and having coverage through the weekend. That doesn't mean you'll have continuous erections the entire time. It simply means that with stimulation, it may be easier to achieve one compared to not taking the medication. Vardenafil has the fastest onset among these options. Some studies show it can start working in as little as 10 minutes, although it's still recommended to take it about 30 to 60 minutes before intercourse. It's generally well tolerated and can remain effective for about 5 to 7 hours. However, it's best avoided if you're taking medications that affect your heart rhythm, because it has a unique side effect called QT prolongation. Avanafil is another option that dissolves quickly in your mouth and may also work faster than traditional pills. Overall, these medications tend to be similarly effective, but not everyone will respond to them. Research shows that about 60 to 70% of people experience improvement, while 30 to 40% do not. If you fall into that group, you're not alone. It simply means you may need to explore other ways to improve your erections. Also, about half of people who begin using these medications may notice they stop working as well after 2 to 3 years. So again, this isn't unusual. These medications do have a failure rate. If you're confident you're using them the right way and still not seeing results, it may simply be time to visit your urologist and discuss other available options. There are also a few important precautions to keep in mind when using these medications. If you take anything that contains nitrates, such as nitroglycerin placed under the tongue for chest pain, you should not use these drugs. Also, if you're on what's called an alpha blocker, like tamsulosin or Flomax for urinary symptoms, you should separate these medications by at least 6 hours. Aside from that, they are generally safe for most people. If you have kidney or liver problems, your dose may need adjustment, so it's important to speak with your urologist or primary care doctor. If you're dealing with erection problems, don't ignore it. Have a conversation with your doctor. Erectile dysfunction can act like a warning sign, similar to a canary in a coal mine. In other words, difficulty with erections may indicate issues with blood flow in the penile arteries, which could also point to early signs of vascular or heart disease. That's why it's important to get your blood pressure, cholesterol, and blood sugar checked to rule out conditions like diabetes. All right, I hope you found this video helpful. As always, take good care of yourself, because you truly deserve it. Thank you.